All right, so this is the ear exam following the eye exam on the comprehensive physical. So now that you finished the eye exam and you put your ophthalmoscope away, now you're going to want to put together your otoscope. So find this attachment here, put it on just like you did the ophthalmoscope. And then you're going to want to put one of these on. You're going to want to do one for each ear.
That way, in case someone actually does have an ear infection in one ear, you're not transferring it over to the other ear.
All right, so put that on, clean it off again. Ear side, ear side. All right, so now you're gonna let it dry. All right, ear inspection. So you're gonna stand off to the side, just looking out the outside of the ear and the inside, and then I'm gonna move your ear forward. Mm-hmm. So then looking at the back of the ear, same thing on the opposite side, looking in and around, and then palpation. Just take both hands, palpate the ear, behind the ear, in front, asking if there's any pain or tenderness. Gross hearing. So you're gonna wanna just rub your fingers together. We're gonna stand at 2 feet, so kind of it's about like here. And then you're gonna have them close your eyes. First, you're gonna be like, this is the noise I'm making. All right, my hands are a little sticky right now.
There's a fan in this room.
There's a fan and there's people open tech labs going on. So it's a little loud. So they can't hear it. Grab a piece of paper.
All right, yes.
Is that better? All right. So for this exam, I'm gonna have you close your eyes and you're gonna tell me when you start to hear this noise and when you stop hearing the noise.
Yep.
So when you do it, you're gonna do it 2 times. And then if they can't hear it, then you're gonna move closer, okay? So, ready?
On. Off. On. Off.
All right, so then you're gonna do it on both sides. So she was able to hear both of the times I did it, and if not, then you move closer. All right, Weber's. So you're gonna take your 512 hertz tuning fork, the one without the little knobbies on top. For this exam, you're going to hit it. You can use your piezoform to whack it. You're gonna put it on the top of their head, tell them that you're gonna do that. And a lot of the times, if they have a lot of hair or whatever, try to get it as close to their scalp as possible or else they're not gonna be able to hear anything. All right, so you're gonna have them close your eyes. And then you're just gonna ask if they hear it equally on both sides. So make sure that you put it in the middle of their head. So do you hear on both sides?
Yes.
All right, great. If not, then you know that there's going to be an abnormality on either
it's
side.
gonna lateralize and then you can figure out what kind of abnormality it is by comparing it with the Rhine's test, or Renee's, or Rien's, however you would like to say that test.
Yes. So for the next one, Renee.
Rhine. Renee.
You're gonna use the same tuning fork, and for the first one, you're gonna do it for bone. So you're gonna put it on their mastoid process here. Try not to have your fingers touching the tuning fork. So it's a little tricky if you haven't practiced this in a while. So you're gonna do it here, making sure that the prongs, I don't know if you can see it, they are going this way. That way. And then when you do air, you're gonna have it face this way. See? All right. So I'm gonna have you close your eyes and you're gonna tell me when you stopped hearing it.
Okay.
Oh, and make sure your watch is facing forward before you start so you can see the time. All right. And
stop.
Okay, and then when you flip, don't touch the tuning forks, keep it close to your ear, and you're gonna want the air conduction to be twice as long as the bone conduction. And if not, you'll mark it as abnormality. I wasn't actually keeping time, so I don't really know where I'm at right now.
Sure.
All right, so when you do each ear, you'll have a line for A for air, B for bone. Put it down right after you do one ear, move on to the next ear so you don't forget. And it might trick you up because A is first and B is second on the paper, but you're doing bone first and air second.
And then if you reach twice the time limit for air, you don't have to keep going. You can just stop the test. So you don't have to wait for your patient to actually say it if you've already reached the normal, which is 2 to 1.
Yep. All right, so now we're going to use your autoscope. So turn it on, make sure the light's on, and then you're going to focus. How close do you focus for this one? I think.
Great question.
I think this one you want to focus closer, but we're going to double check our notes right now.
We are going to focus the autoscope. It just says, attach it, advise the patient, tilt the person's head away.
All right. Well, because you're looking directly in their ear, I'm going to focus a little closer.
Mm-hmm.
And you could focus by using this knob on the side, the dial. The lighting in here is awful. This dial, it rotates. All right. So this one they say hold it like a pen. It took me forever to figure out how to hold it.
Mm-hmm.
Hold it like this. See? Pen, like you're writing. All right, so this is her left ear. I'm going to use my left hand. And you're going to use your pinky to brace on her cheek. So you're going to want to actually, and then you're going to use your other hand to pull the auricle pinna back, out and back. So you could get a straighter direct line into their ear. So then you're going to want to put it in their ear first. And then you're going to want to look. All right. So you may see some cerumen, you may see some wax. If there's a lot and you can't see their tympanic membrane, write it down. All right, so next you would switch your speculum and then go to the other side and repeat. So on the right side, you would use your right hand. It's kind of awkward if it's your weak hand, so make sure you practice doing it on both hands. And that is going to be the ear exam for the physical exam.